Hey guys, this is your girl Leticia B. Fikes. I am your hair loss practitioner. I am also a licensed cosmetologist in the state of North Carolina. I am also a licensed cosmetology instructor. I am founder and creator of Create Professional Workshop, and I am salon owner of LaFaze Hair Care Clinic. Okay, guys. So as you already know, we're in the month of August, and August is Psoriasis Awareness Month. So for this whole month, I'm going to be talking to y'all about different things about psoriasis you may or may not know, or just to help you identify it, to let you know what to look for when we dealing with psoriasis, because it can mimic a lot of things that we currently have, like dry scalp or dandruff. So and I'm speaking of the psoriasis of the scalp and not the one that is on the body. So yeah, because a lot of times when we have things that mimic other things, we don't think is as severe as others. Like for example, I actually had a client who had I believe it was psoriasis on her hair, and this is before I became a hair loss practitioner and studying trichology. Um, I didn't know what it was at the time. To be honest, I just tried to shampoo her hair, and it just like this white film over her hair, whatever the case might be. Long story short, she went to the dermatologist to get it treated. She had some shampoo and stuff like that, but due to the shampoo and I guess what was going on with all the inflammation on her scalp, she began to lose hair. It was thinning all over, so it was more of a diffuse shedding. So now that I play a lot of things back, I kind of understand, what the clients have and how to treat it in the next time that I see stuff behind the chair. So it's always great, especially as a cosmetologist, to get educated with some type of trichological knowledge. Because even if you don't want to become a trichologist, the information is important because you don't want your clients to lose hair while you're sitting behind a chair. I know for me, I always was the cosmetologist who specialized in healthy hair. So I wanted to make sure I just didn't only do your hair, but I treat it as well. And not just that, I also educate you on top of that with the information that you need to take care of your hair. So I will always call myself like the the hair doctor. That was my thing, being the hair doctor. So now that I'm in trichology, that's exactly as I see myself. And I'm gonna throw a disclaimer out there. I'm no medical doctor, nor I'm trying to take the place of a medical doctor. I'm no dermatologist, nor do I take the place of dermatologist, but I work with dermatologists and I work with my client's physician to create a custom plan for hair loss restoration. Okay, so off of that topic and on to psoriasis. So yesterday was the first day that we started talking about psoriasis, and I'm just gonna do a quick review on that. So basically, psoriasis is not contagious, but is a chronic autoimmune disease, um, which has skin inflammation, which it also causes you to be very itchy. Sometimes you can identify it with these thick silver plaques, especially plaque psoriasis. Um, you would notice flakes. Um, you would notice like layers of scales, just different things when it comes to plaque psoriasis. So that's what we talked about on yesterday. I just want to make sure that I haven't missed anything. I did go into details of how is the when you're dealing with psoriasis, you have this overproduction of skin cells, and it layers up, and you also the capillaries dilate. So that's why a lot of times when you try to pick it, you kind of see you run into some blood or whatever the case might be. So you have to be careful with that. Okay, so today, let me before I get to that, let me tell you about some of the causes of psoriasis. Of course, genetic components. There are environmental triggers, trauma and infections. Okay, so today I wanted to talk to you about the different type of psoriasis that you may encounter when you see it. Um, the main one that I'm probably going to be speaking about is plaque psoriasis, because that's dealing with the psoriasis that is on the scalp. And since I am a hair loss practitioner, that's what I deal with, hair and scalp. So, number one, plaque psoriasis, which plaque psoriasis is the most common one. And basically it's flattened areas that are elevated, inflamed, sometimes red, dilated with blood vessels, white silvery scales. Um, they're tender to touch, they're itchy, and a lot of time you will also see this on your elbows, knees, growing, and lower back. So that is plaque psoriasis. The next psoriasis I'm going to talk about is called glutate psoriasis. Well, glutate psoriasis is small red individual spots that's in the trunk or the limbs. It starts in childhood and is also triggered by an infection like strep throat. Okay, inverse psoriasis. So when you think of inverse, you think of the middle of something. So inverse psoriasis, there are smooth spots and shiny spots, but you will see this like in the folds of your elbows, your the folds of your knees. You will also see this like under the arms and under the breast. Okay, so you have pustular psoriasis. So pustular psoriasis, they are red, with white elevation of pus, tenders, and you'll see this also on your hands and feet. Um, Erythremic psoriasis. So erythremic psoriasis is red. So just think of red. Scales, extreme itching, it's very painful. The scales fall off like sheets. And when you dealing with this, you also deal with a lot of inflammation in the joints. And with all the psoriasis that I mentioned, um, in some cases, you will see some evidence in the nails, and it's called pitting. So you will see psoriasis of the nail that's called pitting. So when you're dealing with psoriasis, the way you can diagnose this is basically by identify it by looking at it, or a biopsy from a dermatologist. And some of your treatments would be moisturizers, emollients, um, and that's just to clear the plaque off and to minimize the itchiness. You have your topicals, different therapies, photodynamic therapies, and stress management therapies. Like you want to make sure that you're dealing with different ways of treating it, especially if most of the psoriasis are triggered by stress. So if it's triggered by stress, you will reduce the stress by doing stress reduction therapies. And if you're dealing with the plaque, you would put certain moisturizers and emollients on top to get rid of the plaque. And then there's other treatments that you can put on to to reduce the inflammation and resolve the itchiness and things of that nature. Okay, guys. So I hope that information helped you out to identify the psoriasis or anything like that. What you can do is if you feel like you have plaque psoriasis and you thought you was having dandruff this whole time or severe dry scalp or growing dandruff as people seem to tell people, make sure that you go ahead and schedule um your complimentary consultation with me so we can get to the root of the problem. With that being said, I am Letitia B. Fikes, and until next time, you guys stay educated.